Together we achieve victory over heart failure.
Hello everyone, I am Dr. Sunip Banerjee from Kolkata Heart Lung Center. We are going to discuss today some common misconceptions regarding cardiac issues like heart failure and heart attack. So one important concept or myth means we believe certain things which are actually not real. So one of the myth is heart failure only targets the elderly population. It's not like that. The elderly populations actually more susceptible to get it because of their multiple combination of disease like hypertension, diabetes, coronary artery disease, heart rate irregularity. But doesn't mean that in younger age group you will not get heart failure. It is actually a multifactorial thing because it is related to bad lifestyle. It is related to susceptible gene or family history of heart failure. So heart failure can target any population, elderly or young. The second myth is only chest pain means a heart attack. No, although chest pain often a signal of heart attack, but other symptom more commonly happens during heart attack that we need to understand, that the discomfort in the back, in the neck, or in the arm, and sometimes you get lightheadedness and feel that your oxygen requirement which is there is getting short. You feel some abdominal symptom like nausea, vomiting, and the more you burp you find that it is going to clear, and people thinks that this is gas but or GI symptom, but it is not. So heart attack is actually can be presented with this atypical symptom, and that's the reason most of the time we miss a localized chest pain with fever. It is very unlikely that it's a heart attack. So remember one thing, that many people they said that we didn't have a chest pain, so how I suffered a heart attack. It's because that chest pain is not the only manifestation of heart attack. And is heart failure means that your heart has stopped? No, it is not like that. Heart failure where the heart function is reduced and heart find difficult to supply the blood according to the demand in the body. And there is another concept of heart failure, which is a heart failure with normal pump function, but the heart muscle gets stiff, so it cannot accept the blood from the periphery. So the blood get accumulated into the lungs or on the limb, and people get either leg swelling or breathing difficulty. So it doesn't mean that heart has stopped, heart is working, but definitely it's struggling. So our purpose is to change the lifestyle, give medicine, and look into the cause and treatment which will be helpful for this patient with heart failure. The fourth myth is a long-term smoker can lower the risk of heart attack. Yes, they can, but if they quit smoking. So within a year of stopping more smoking, you can have a 50% decrease in risk of heart attack. And although you may not be as beneficial like a non-smoker, but the moment you stop it, it decreases significantly the chances of future heart attack. And there are people who thinks that by quitting smoking you can get a heart problem. No, it is not like that. It's psychological. The last myth is important to know, that with heart failure or who have a heart attack, they should not exercise. This is a wrong concept. After a heart attack, you should start doing your work as soon as possible according to the advice of the doctor. And many times we have seen that we have told patient very clearly that you try to do activity as tolerated, but they are scared, and the more you do less physical activity, your heart will be deconditioned, and you'll never be able to go back to your normal life. And more importantly, your diabetes, cholesterol, and blood pressure, all these things, and weight gain will be a significant issues in future if a patient with cardiac disease, be it heart attack or heart failure, does not want to resume the exercise after the acute stage is over. So in heart failure or in heart attack, exercise with a graded increment is must. Thank you for listening.